Suicides among military service members are on the increase. A new study looks at the psychological autopsies of these service members to better learn why the military suicide rate is climbing and what can be done to address the issue. ASU psychology professor Dr. Rebecca Blay was among those conducting the research, and she joins us now. Welcome to Arizona Horizon. Good to have you here.
Thank you for having me.
Military suicides, we have talked about this issue on this program. It does seem like it's increasing. Is it increasing?
It continues to increase. A number of years ago, serving in the U.S. military used to be protective against suicide risk. But what we've seen over the last 20 years is it's steadily increasing. And at this point, the risk of death by suicide is a bit higher among those who have served in the military compared to civilians.
I find that interesting. Protected in the past. Explain that, please.
It's challenging to understand why it might have been protective in the past. One of the things that makes military research difficult is that wars are different each and every time. Some of the Vietnam era veterans will tell you when they came back to the States after deploying to Vietnam, they were not welcomed back. They were not thanked for their service. We are seeing something much different with the folks who have served in Iraq and Afghanistan. We're also seeing warfare change substantially. So the war environment is an ever-changing culture. We're also seeing one of the most diverse fighting forces that we've had in our history. So there are so many factors at play where it's almost like a combination lock. As one part changes, another part changes. And so it can be difficult to pinpoint exact causes.
And that those can all be stressors, true?
Absolutely, they can all be stressors.
Yeah. As far as the increase, is it a steady rise? Was it peaks and valleys? Was it a spike?
Yeah, it certainly wasn't a spike. And we are seeing there are some dips in it. So a number of years ago, actually during the pandemic, we did see it go down just a little bit.
Interesting.
But when we've looked at it over the past 30 years, it looks like it's a more rising trend.
Okay, this study for the Department of Defense, what did you look at? What did you find?
Yeah, so our team was tasked with looking at all policies and procedures related to how the Department of Defense handles suicide. So we reviewed all policies and procedures. We visited 10 high-risk military installations, interviewed over 2,500 people to understand what they thought was going on. And then we spent about 4 months as a team trying to understand what is it that needs to change in order to see this trend go down.
And what does need to, I see guns are in here as well, different kind of, and this is interesting, for firearms, maybe a different kind of method in terms of gun control, if you will, for service members because they come from a different kind of background with firearms.
Yeah, that's one of the things that we definitely looked at. And I think it's a particularly hot topic because when people hear about this, they might think that our recommendation was to limit gun ownership. And that wasn't what we suggested at all. Simply what we suggested was thinking about the times in which service members could purchase firearms. And so having a delay period in terms of when you purchase and when you pick up, or not being able to buy firearms at the same time. One of the things that I would say that's probably most important, or the thing that I noticed the most across these installations, is death writ large is very challenging to talk about. It doesn't matter how someone dies, but when someone dies by suicide, people had a particularly hard time knowing how to talk about it. And so what we often saw was that people wouldn't talk about it because they didn't know what to say. And so what that sends a message to the survivors is that the life was expendable when really it wasn't. So a lot of what we talked about was trying to teach people how to talk about suicide even when it's difficult, and being really careful not to insert your own personal beliefs about suicide when you're giving that message.
That's really interesting, and I go back to the original point of how maybe in past generations being in the military was a protector in terms of, did people address suicide back in the 40s, 50s, 60s, whatever it was, differently?
I can't say that they did. One of the things that I think we've seen over time is that we do tend to get a little bit better in our methods. And so mental health related difficulties were not necessarily discussed in the 40s and 50s. So I don't think that that was probably what was going on. I think it's a changing demographic. And I think our understanding of how suicide occurs has also changed.
Yeah, I noticed the report also mentioned making the military better suited for families.
Yes.
Explain, please.
Yeah, if you look at the constellation of what the military has been over the past hundreds of years or since the inception of our country, it's largely made up of family members where the male or the dad will be serving and he'll have a family at home. There'll be a wife taking care of children. But we're seeing more than ever that there are dual career military families. And what we've seen is that there were occasions where one spouse would be deployed to one country and another to the other. And then when there are children involved, it's not necessarily easy to figure out who stays home when the kiddo's sick.
Yeah, yeah. As far as hazing incidents, as far as sexual assaults, we read about these stories. Are they more common, or are they just being reported more often?
They're being reported more often, and sometimes they're becoming more blatant. A number of service members relayed stories. There was an individual who went into the military to secure citizenship to our country, and when he handed in his papers to his officer to get the paperwork going, his officer took a lighter to it and threatened to set them on fire. And so this is someone who is coming to our country to live and to be a serviceman and to give up their life, and that's how they're being treated. There are also, when it came to sexual assaults, people would say, like, you know, it's just as hurtful and damaging to report it because of how they're treated afterwards. And so people are reporting, but it does come with a number of consequences.
Yeah, wow. Department of Defense wanted the study. They got the study. What are they doing with it?
What are they doing with it? So we spent 6 months after I was part of the implementation committee, and so we came up with a plan to institute about 87 of the recommendations. The recommendations that were not put forward were things that would have been just logistically impossible or are actually already in the pipeline. And so we put together a plan to institute those 87 recommendations, and those will be put into place over the next 2 to 3 years.
We only got about 30 seconds left here, so I can't get all 87. I can't even barely get one. Give me the elevator speech on one.
Elevator speech, I think you need to know how to talk about suicide when you're in a position of control.
Yeah.
And so tell people that they matter. And when you lose someone by suicide, it's important to acknowledge the loss and to take care of those people that are around them.
Very good. Dr. Rebecca Blais from ASU, thank you so much for being here and sharing your information. It's good stuff. Thank you.
Of course. Thank you.